Assalamualaikum warahmatullahi wabarakatuh and good morning everyone. I hope you are all doing well. Welcome to our webinar on the impact of sugars on adipose tissue, or also known as fat tissue. My name is Suraiami Mustar from the Nutrition Unit, Institute for Medical Research, Ministry of Health Malaysia at Setia Alam Selangor, and I will be the moderator for today's sessions. Before I proceed with today's topic, let me introduce Nutrition Unit. Nutrition Unit is one of the units under the Nutrition, Metabolic and Cardiovascular Research Center. Our mission is to improve health by conducting quality research to address national health priority areas such as obesity and diabetes. Our research area focuses on nutritional biochemistry, analytical food chemistry, functional food, and so on. We are involved in the Malaysian Food Composition Database Program, which updates the nutrient content of Malaysians' food in the database. We are also involved in the National Iodine Deficiency Disorders Eradications Programs, and we serve as the National Reference Center for Salt Iodine Analysis. Annually, we provide iodine detection test kit to health centers all over Malaysia to monitor the IDD program. Our current networking and linkages include international organizations, government agencies, and universities. If you have any inquiries or looking for any collaborations with our unit, please contact the head of Nutrition Unit, Dr. Aswir bin Abdul Rashid. Before moving forward, I would like to thank our DG, our Deputy DG, and IH Manager, IMR Director, our Head of Center, and our Head of Unit for giving the opportunity to us to present in this webinar. Before moving on to today's presentations, here are some housekeeping messages from the Secretariat. The questions and answer sessions will be conducted after both presentations have ended. But you may post your questions using the link shared on the YouTube channel. An attendance link is also provided for those who would like to receive an e-certificate of attendance. Lastly, please subscribe to our National Institute of Health Malaysia YouTube channel for more notifications. Coming to our presentations, the theme for today's webinar is Sweetened Science, Impact of Sugar on Adipose Tissue. Since our topic is about sugar and its impact on health, I have a few questions that I would like you to consider. Have you ever thought about how much sugar you are eating every day? How do you usually kick off your day with breakfast? Is it with something sweet like cereals or pancake? Or with something savory like nasi lemak or egg sandwich? What is the choice of healthy food have you made recently? Example, swapping soda for mineral water or swapping chips for nuts? Well, I leave all these questions to you to think about. Let's move on to our presentation. Our first speaker is Dr. Lim Han Yin. She is a medical officer. She is the medical officer who has been serving. She is a medical officer who has been serving the Ministry of Health Malaysia for the past 11 years. She obtained her medical degree from the first Moscow State Medical University. She has experience in clinical practice and specializes in nutritional medicine. She is also experienced in primary and antenatal care and has been with the Nutrition Unit since March 2022. Currently, she is doing 2 research projects as a collaborator and is the principal investigator for the systematic review on the impacts of omega-3 supplementations in pregnant women towards the intelligence status of toddlers. Let's invite Dr. Lim Han Yin to deliver his speech. The screen is yours, Dr. Lim.
Okay, thank you, Dr. Suraiami. Good morning, everyone. Welcome to IMR-SEAMEO Webinar. I'm Dr. Lim, a medical officer in the Nutrition Unit NMCRC IMR. Today, we will delve into the sweet sabotage and revealing the sugar-body connection, exploring how sugar impact our health, particularly in relation to the inflammation and cardiovascular disease. Let's get started. Firstly, let's focus on the evolution of food. Over the past few decades, our dietary pattern has undergone significant changes. In traditional diet, we see a variety of whole food, including plenty of vegetables, lean proteins, spices. And these diets are naturally lower in sugar and provides essential nutrients for our bodies. However, as we move to the modern era, there has been a significant shift. The modern diets usually consist of processed food and high in sugar. The processed food such as sugary cornflakes, fast food, soft drinks, sausages, cookies, instant noodles already become common in our diet. So this big shift is already have a big impact on our health. The rise in obesity and chronic diseases can be linked to the increasing consumption of processed food and sugary diet. See how is our food environment already promotes the excessive sugar in our diet. Let's see the global context. This is the prevalence of diabetes worldwide. In 2019, approximately 9.3%, which is 463 million in the population, is living with diabetes. Okay. And this number is estimated to be increased to 10.2%, which is 578 million by 2030, and 10.9%, even 700 million in the population by 2045. This is the key findings from the National Health and Mobility Surveys 2023. It shows that 15.6% of population in Malaysia have diabetes, which means that 1 in 6 of every adult in Malaysia already have diabetes. So, where's the sugar in our diet actually coming from? From my clinical experience, many diabetic patients told me that they actually didn't eat much of sweets or chocolate or soft drink or dessert in their diet. The sugar they know that in their diet usually is rice and some sugar they added in their coffee and tea. So they tend to replace the rice into mee hoon, kway teow, egg noodles. And some of the patients even tell me that dinner they only take like few pieces of kueh muih, which actually is higher in sugar and is worse. And also this kind of chocolate snack bar, and it is considered processed food and high in refined sugar. Fruits are healthy, right? Yes, fruits is in the one of aspect of healthy, but fruits actually has a lot of fructose. So, just like durian, longan, lychee, watermelon, and mango is high in fructose. I will talk about fructose later. Apart from sugar and fruits that we know from our diet, we obtain sugar usually from carbohydrate, which our body will break down the carbohydrate into sugar. The carbohydrates such as rice, noodles, bread, roti canai, all these will break into sugar in our body. So what can we eat then? We actually suggest to eat more of complex carbohydrate, which have more nutrients and take longer time for the body to digest. So they can help to fill you up, make you full, and don't cause the same swing in the blood sugar as simple carbohydrate. This is a table to show you a brief idea of what is complex carbs and what is simple carb. Usually complex carb is coming from a whole food, natural whole food, and simple carb is found in processed food. There are main dietary sugar that are absorbed from the liver. It is glucose, fructose, and galactose. Our body actually needs sugar to produce energy. But when there is excess sugar, then there is the problem comes in. Here I would like to emphasize glucose and fructose and their differences. When we consume glucose, our blood sugar level increase and stimulate the insulin secretion. About 15 to 25% of glucose are metabolized in the liver and stored as glycogen. The rest are taken up by muscle cell, adipose tissue, brain cell to produce energy. How about fructose? Fructose surprisingly didn't increase any blood sugar directly and didn't stimulate insulin secretion. There's no parts of body use fructose to produce energy. The only place it goes is to metabolize in liver to convert into lactate and glucose. So initially we thought that fructose is better than glucose because it doesn't increase blood sugar directly. It also didn't stimulate insulin secretion. But over years of our research, we realized that no, fructose is actually worse than glucose. And fructose is actually the silent killer. Because fructose causes an increase in triglyceride more than glucose and causes an increase in inflammation marker as well. And there is no inhibition of liver metabolism, leading to uncontrolled fat production. So it leads to non-alcoholic fatty liver disease, NAFLD, which is already increasing cases in our clinics. And many patients doesn't know about this. Fructose actually increases uric acid level and worsening their gout situation. And causes also insulin resistance leading to diabetes. And there's a saying, fructose promotes thin on the outside, fat on the inside, which increase accumulation of visceral fat. So, where is the fructose in our daily diet? Do you have a breakfast today? How is your breakfast looks like? Is it like this? It looks healthy, right? With cornflakes, muffins, breads, and jam, pancakes, donuts, or with cakes and juice. All these foods contains high fructose. And also our pancake, waffle, pastry. The only whole food here in this picture is the walnuts. That is healthy. And how about fruits? Fruits are healthy, right? Yes, in one aspect, fruits are full of minerals and vitamins. But fruits are also high in fructose. Be aware of that, especially watermelon, banana, papaya, honey lemon, mango, and also our beloved durian. Some people think that the drinks that is juice that is nice and is healthy, but it's wrong. Juice are worse than when you eat the whole fruit because it already eliminates all the fibers and the only thing you get is fructose. So your body can absorb fructose even easier when you drink juice. Then our trend of boba tea. Boba tea also has a lot of fructose because they add syrup inside. And do you see these familiar chocolate drinks? Yes, it's also high in sugar and especially fructose. And when you go to restaurant, they will have fancy drinks like cucumber or tomato with mint. It looks very healthily and refreshing. But sadly to say, yes, they added soda and some syrup so it's also high in fructose. The excessive or sugar intake over the time leads to metabolic syndrome, which is diabetes, hypertension, central obesity, and dyslipidemia. This is from the key finding from NHMS 2023. It shows that over 500,000 Malaysians, or 2.5% of adults in Malaysia, live with 4 non-communicable diseases. It is diabetes, hypertension, high cholesterol, and obesity. And these are the risks, a major risk factor for heart disease and stroke. And almost 2.3 million of adults in Malaysia live with 3 non-communicable diseases. And you see the combination of the 5.1% is diabetes, hypertension, and high cholesterol. So, how fructose leads to inflammation and metabolic disorder, increasing the risk of chronic disease? When we have excessive sugar intake, our body tends to releasing inflammatory markers such as TNF-alpha, TGF-beta, and F-kappa B, and interleukin-6, and then cause inflammation and systemic inflammation in our body, and it leading to metabolic syndrome. And metabolic syndrome will constantly give inflammation to our body as well. At the end, we got a chronic disease. There is another pathway. I will discuss it later. This is a study on 1999 to 2010 in US. Just by decreasing consumption of sugar sweetened beverage, is already can see the improvement of biomarker of chronic disease. This is from the study. It shows that high density lipoprotein HDL increased significantly, and low density lipoprotein LDL decreased significantly. And CRP, which is a systemic biomarker, inflammation biomarker, decreased significantly as well. Let's see about another pathway. When we have excessive sugar intake, our body actually tends to store fat and increase visceral fat. And those visceral fat releasing inflammatory markers and causing inflammation continuously over the time, we will get metabolic syndrome, and the inflammation continue to occur and leads to chronic disease, such as the non-alcoholic fatty liver disease, chronic kidney disease, cardiovascular disease, and diabetes. This is a blood sugar chart. When we are eating complex carbohydrate, we tend to have a stable sugar. And when it is stable, our body releases fat and protects lean muscle, eliminate cravings, and increase energy. But when we have too many calories or carbs per meal, and also simple carbs and processed food, our blood sugar spikes. And when it spikes, insulin comes in and body stores fat. And when insulin comes in, our blood sugar will drop drastically, and then we will have energy crashes and craving increase. So it will become a vicious cycle when you eat processed food and simple carbohydrate. So where is the fat in our body that the body stores? That is subcutaneous fat that is under the skin, visceral fat among all the internal organs, and retroperitoneal fat that is behind the abdomen cavity, behind the layer of peritoneum. And when the fat stores, we have moderate risk to have chronic disease. And if you see here, visceral fat is more than the subcutaneous fat, then it will be a highest risk for us to get chronic disease. Bear in mind, there is the saying of thin in the outside, fat in the inside. So not necessarily you are looking like thin, but if you have visceral fat a lot in your body, you are still in the highest risk to getting chronic diseases. And please be mindful, visceral fat is not just regular fat. It is an active fat that produces hormones and inflammatory substance. This is a study that shows that the fructose induces inflammation and increased cortisol. That is another mechanism for fructose to induce visceral adiposity. In here, the study shows that fructose increase cortisol and induce the visceral fat accumulation, and it cause of triglyceride, cause insulin resistance, cause systemic inflammation, and then, yes, it leads to chronic disease, especially cardiovascular disease. I would like to emphasize on epicardial adipose tissue, EAT. The EAT is actually situated between the layers of visceral pericardium and myocardium. See the yellow layer here. And it is also surrounding our heart. Okay. And this is the study showing that epicardial adipose tissue, EAT, is actually developed arterial fibrillation, coronary artery disease, chronic heart failure in obesity and type 2 DM patients. And in the study, it says that elevated EAT mass both secrete pro-fibrotic and pro-inflammatory adipokinase and form an intramyocardial fibrofatty infiltrates. It means inflammatory markers and causing inflammation. And that's because situated in the heart, so it is strongly implicated in cardiovascular disease. We are actually doing a study in IMR regarding EAT and cardiovascular disease in diabetic patients. Later, our next speaker, Dr. Wan, will say further about this study. Let's see the Framingham risk score. Is to estimate the 10 years cardiovascular disease risk. If you have diabetes, you can see your risk score is already high, 3 to 4. And if you are age more than 40 years old or the age more than 30 years old and having diabetes more than 15 years of duration, your risk is exactly straight away become high risk. So as a conclusion, sugar consumption will cause systemic inflammation and increase risk of chronic disease directly and indirectly. And the elevated inflammation markers will EAT growth and a higher likelihood of cardiovascular incidents. So let me conclude a bit. When we have excessive sugar intake, our body tends to increase adiposity. Then it will cause systemic inflammation and increase cardiovascular risk. This is my reference. Thank you for your attention. Hope you have a clear picture of how sugar impact our health. Thank you. Back to you, Dr. Suraiami.
Thank you, Dr. Lim, for the interesting talk. Now we understand how the role of sugar in modern diets has expanded dramatically and brought significant consequences to our health. If you have any questions for her, please submit your questions using the link provided on the YouTube channel. Next, I would like to introduce our second speaker for today. He is Dr. Ahmad Syazani Mohamed, a medical doctor who has been with the Ministry of Health for more than 11 years and has been with the Nutrition Unit since November 2022. He holds a degree in MBBS from UITM and a master's degree in pharmacology from USM. Currently, he is pursuing his PhD with the University of Malaya in medical pharmacology. His research interests are medical pharmacology, nutritional pharmacology, and drug-nutrient interactions. Let's all welcome Dr. Ahmad Syazani to deliver his speech. Over to you, Dr. The screen is yours.
Okay, Assalamualaikum warahmatullahi wabarakatuh and a very good morning. Thank you to our moderator, Dr. Suraiami, and to our speakers, Dr. Lim Han Yin, and also to all the audience that attend to this webinar this morning. Hello and good morning. My name is Dr. Ahmad Syazani Mohamed, a medical officer from Nutrition Unit and MCRC IMR, who would like to present my topic, entitled The Role of SGLT2 Inhibitors in Modulating Metabolic Biomarkers and Epicardial Adipose Tissue Thickness. Before we start, have you started to feel hungry by those slides? Yes, me too. Yeah. Okay, let's talk about epicardial adipose tissue. Based on, as mentioned by Dr. Lim Han Yin during her presentation just now, that excessive sugar may lead to visceral adiposity and also cardiovascular risk. Therefore, it is important for us to know in detail regarding one of the most prominent visceral adipose tissue that can cause cardiovascular disorder, in which is epicardial adipose tissue. Anatomically, epicardial adipose tissue is located between the heart muscles, or also known as myocardium, and the outer part of the heart, in which is pericardium. It surrounds the myocardium and also supplied by the coronary vessels, and also produce numerous cytokines that are essential for metabolic homeostasis. Physiologically, a normal EAT provides a constant body temperature, in which in scientific way provides body thermoregulations. Aside from that, it also maintaining rhythmic contraction and relaxation of the coronary arteries. In addition, it also protects cardiac nerve. Well, pathophysiologically, increase of EAT are highly associated with incidence of obesity, metabolic syndrome, insulin resistance, and also coronary artery disease. However, there are several studies that are convincingly demonstrated that SGLT2 inhibitors, or also is a type of anti-diabetic medication, was able to reduce amount of visceral adipose tissue by caloric elimination, thus indirectly reducing EAT thickness. As what we can see here below, that essentially we have several types of SGLT2 inhibitor in global market. So I do think in Malaysia we normally familiarize ourselves with Forxiga, which is the dapagliflozin, and also Jardiance, in which is empagliflozin. Other countries may also use Ivoncana or canagliflozin. The terms is quite confusing, but I do hope that you guys can bear with me with SGLT2 inhibitors, okay? As mentioned by Dr. Lim just now, that visceral adipose tissue, particularly EAT, could predict an undesirable metabolic and cardiovascular risk. Therefore, EAT has been studied as a measuring point for the effectiveness of SGLT2 inhibitors. So let's go to a deeper question. What is SGLT2 inhibitors? So for those that know regarding SGLT2 inhibitors, please comment in our YouTube channel, or we can proceed with this juga. So SGLT2 inhibitors is a new class of drug that promotes the renal excretion of glucose in patients with type 2 DM by blocking SGLT2 receptor at the kidney. This will cause a more glucose to be excreted from the urine, and later on the body will use up fat as a replacement for energy. Consequently, it can indirectly cause weight loss due to its ability to reduce visceral and also subcutaneous fat. These interesting findings of glucose lowering effect by SGLT2 inhibitors and also epicardial adipose tissue has brought us up for EPICAT study. Our current research project, in which the effect of SGLT2 inhibitors on epicardial adipose tissue in type 2 DM patients with coronary artery disease, or also known as EPICAT study, is a clinical and biomedical study that aims to investigate the effects of SGLT2 inhibitors towards several parameters, in which is anthropometric measurement, metabolic biomarkers, and also echocardiographic parameters with type 2 DM patient that also diagnosed to have coronary artery disease. In view of echocardiographic parameters, we're also going to look its effect towards epicardial adipose tissue thickness and also cardiac function. So this is the brief methodology of our study. Our study design is actually a prospective quasi-experimental cohort with our sample size estimated around 360 patients that is selected. We subdivided into two, in which the first group is non-SGLT2 inhibitor, which is control, and SGLT2 inhibitor group. And for your information, we already started this project since June 2022, and we are expecting to settle this recruitment also follow up in October 2024. We also recruit in two sources of place, in which is UMMC Cardiology Outpatient Clinic, and also UMMC Cardiology Inpatient Ward. This is the summary of our inclusion and also exclusion criteria. For inclusion criteria, the patient will be recruited if the patient is a Malaysian adult with type 2 DM and also diagnosed with coronary artery disease. And also for female, a patient must be not pregnant, also breastfeeding during the recruitment. And patient will be excluded if the patient have other types of diabetes, if the patient having a CKD stage 4 or 5, history of diabetic ketoacidosis, if patient is pregnant or breastfeeding, having a drug interaction with SGLT2 inhibitor, or having urinary tract infections during the course of the study. This is the research flow of our project. As what we can see here, we have two time points, which is the first visit and also the follow-up visit. So both visit, we are going to check for anthropometric measurement, blood taking for metabolic biomarkers, and also echocardiographic parameters. But for our presentation for today, we are just going to concentrate on these parameters only. As for preliminary results, currently we have able to recruit around 360 patients, and 128 patients are successfully completed the study. As I mentioned to you just now, this is only a preliminary result, so we just going to illustrate it in infographically so that the public can understand regarding the findings. So in terms of gender, male is more predominant in both groups, while for age category, both groups have more patients in 65 years and above category. And for ethnicity, Indian is slightly predominant in both groups. While for medical and cardiovascular history, as we have said before that we have said that all the patients that we recruited should be a type 2 diabetic patient. So there are type 2, therefore there are all cases is type 2 diabetic patients, with slight predominant in hypertension and also dyslipidemia. And for cardiovascular history, there is a slight predominant in non-STEMI cases, in which the meaning of non-STEMI is actually non-ST elevation myocardial infarction. For metabolic biomarkers, both non-SGLT2 inhibitor and also SGLT2 inhibitor have shown changes in fasting blood glucose and also HDL. While SGLT2 inhibitor group shown a significant improvement in other parameters such as HbA1c, cholesterol, LDL, and also triglycerides. In view of epicardial adipose tissue thickness throughout 6 months for non-SGLT2 inhibitor group, they show a slight increment, while for SGLT2 inhibitor group, there is a significant reduction of EAT thickness. The possible mechanism that cause significant changes in metabolic parameters and epicardial adipose tissue thickness is due to the renal excretion of glucose, causing loss of calories in the body. And thus, it can lead to a shift in energy metabolism, in which involve of the breakdown of the fat, is what we call as lipolysis. Thus, it can cause a glucose and lipid profile improvement, as well as reduction of visceral adiposity. As for conclusion, the improvement of metabolic biomarkers and reduction of epicardial adipose tissue thickness with SGLT2 inhibitor highlights the medication benefit as an effective anti-diabetic agent to reduce blood sugar and also visceral adiposity. So this is the list of our presentation and also publication that has been done for our project. So as what we can see here, there are 3 abstracts have been successfully published under International Journal of Cardiology last year. We also did publish an article relation to epicardial adipose tissue this year in Adipose Journal. So for our future plan, we plan to investigate the pharmacogenetic aspect of SGLT2 receptor gene in relation to the treatment response of SGLT2 inhibitor in type 2DM patients with coronary artery disease. We also would like to assess for its micronutrient as well, to assess the possible of nutrient deficiencies or excess in type 2DM patients with CAD who were treated with SGLT2 inhibitor, and to conclude if there is evidence of drug-nutrient interaction. Special credit to my team in which in NIH and also in Himalaya for their efforts, and also continuous effort towards the project. So this is our references, and that's about it. Back to you, Dr. Suraiami.
For your insightful presentations. Now we will move on to the questions and answer sessions. Please do not hesitate to send us your questions using the link provided on the YouTube channel. I will try my best to connect you to our distinguished speakers. However, if the time does not allow us to address all the questions, our speakers will try their best to answer your questions through email. It seems that we have received a few questions from the audience. Moving on to the first questions. This question is for Dr. Lim. Just now you mentioned that fructose increases visceral fat. How about glucose? Will it increase visceral fat as well?
Oh, okay. Glucose also will increase visceral fat. Okay. But the process is a bit different with fructose. When we are consuming the glucose, our body will use glucose visceral fat. Okay, so compared to fructose are only metabolized in liver, and there is more directly to store as visceral fat, whereas glucose are more broadly used in all the cells. But be mindful that if you have excessive glucose, it will still store as fat and also visceral fat. Thank you.
Thank you, Dr. Lim, for your response. I think we have another questions. This question is for Dr. Wan. How do you measure epicardial adipose tissue using an echocardiogram?
Thank you for the question. Very, very good question indeed. So actually, for us to know that how to measure epicardial adipose tissue thickness, first of all, we must consent to the patients that during the study must have our consent to the patient that we're going to do an echocardiogram, and then once a patient already agreed with our project and all, we actually must put the patient in a supine position. By means that the patient must be positioned at the left lateral decubitus position. What I mean is for left lateral decubitus position is that the patient must be lying at the left lateral part while both legs remain straight. By doing this, actually we can have a very, very good view for parasternal long axis view. So by doing parasternal long axis view, can I use my slides for a while? Okay, all right. Okay. So this is the image of epicardial adipose tissue. So what I can say is that we should use this point in which what we call as aortic root. We use aortic root as a reference point, and we put with a right ventricular free wall. We align with right ventricular free wall and also aortic annulus at the aortic root. Straight, and also we can get a very, very good view of epicardial adipose tissue. So this is the hypoechoic space that is located in between epicardium and also pericardium. So this is epicardial adipose tissue. So how to measure it? We just going to measure it using a ruler in the software, and we use it and we measure it vertically. Yeah. This is a good picture of how to measure epicardial adipose tissue as well. So you can read down this also. Okay, thank you.
Thank you, Dr. Wan, for your answer. I hope the viewer have understood how the process is being done. Moving on to the next questions. This question is for Dr. Lim. What is the impact to the baby if the mother heavily consumes fructose during pregnancy? This question is from Nurul.
Hi, thank you. Thank you, Nurul. Actually, when the mother heavily consume fructose during pregnancy, it's easily to get we call it GDM, gestational diabetes mellitus. So when the mother has GDM, we always close monitor in our clinics, or the KK, Klinik Kesehatan, because it has a very big risk for the baby to grow very big, okay, until you cannot deliver normally and can only deliver by cesarean section. And for the baby side, actually the baby has a risk for her birth defect as well. Okay, some congenital disease might happen. Okay, and don't forget about when you have the mother has cesarean section, because of high fructose and your sugar is high in your blood, the scar the scar, I mean the wound of the cesarean section is very hard to recover. Okay, so there will be a lot of complication inside because fructose is causing inflammation in our bodies. Thank you.
Thank you, Dr. Lim, for your answer. We have next questions. I think this is for Dr. Wan. What would be the most challenging part of conducting your study, Dr. Wan?
Oh, thank you for those that asking the question. So actually, one of the most challenging part of conducting this kind of research is actually when we want to recruit the patient. So once we recruit the patient, we have to know that the recruitment itself is actually quite thorough. By means that we have to include the inclusion criteria and also exclusion criteria as well. So by means that once the patient agreed to be recruited, we must have a constant communication with the patient. Bear in mind that most of the patients that have been recruited just now, based on what infographic that have been told you, that most of the patient is elderly patients. So by means that we must have a constant communication with the patients, along with the caretakers as well, so that both three parties are in line for the patient to be followed up under our study. So the the caretakers themselves also must know about this project, and also it will be beneficial for them to follow regarding the follow-up as well. Okay. Aside from that, I just want to share, sometimes patient having, especially for those patients that in SGLT2 inhibitor group, they have some difficulties that they want to add the medication, because once we add once we want to add the medication, there is always a challenge, because not many patients wants to add the medication. So by means that once we want to recruit a patient, we must inform to them that we want to add the medication. That's why they will also want to inform to them the benefits of the medication itself. On the other hand, people also must know that sometimes those medications, regardless of which type of medication, sometimes medication can be quite pricey, and the patient is not afford to buy those medications. And sometimes issue of polypharmacy also play in hand. So proper education to the patient, and also we must inform to the patients that properly that there are some benefits, and also regarding the medication, so that they can understand better regarding the medication and follow with our recruitment, also follow up. Thank you.
Thank you, Dr. Wan, for your response. I think your study is quite challenging. Okay, we have one question to Dr. Lim from Lee. How to get rid of visceral fats? What are the strategy or types of exercise one needs to do?
Okay, thank you, Lily. Uh, okay, to get rid of visceral fat is from our diet. First thing, we reduce refined sugar processed food. Okay, and we take more proteins and more vegetables in our diets. Okay, so that we can reduce the excessive, we can avoid the excessive sugar and store as fat. For the exercise, we will suggest usually using aerobic exercise such as running or swimming. Okay, all these aerobic exercise, if you are doing at least 30 minutes per session, it will start to have a burn your visceral fat. Okay, and we also suggest that if you can do 3 times of exercise in a week, yeah, that is a healthy lifestyle. And also, I would like to add some points that in our diet we should increase some healthy fats, okay, such as from the fish or from nuts and from avocado. All this healthy fat is actually good to to our body, and also is one of the strategy to get rid of visceral fat. Yeah, thank you.
Thank you, Dr. Lee, for your answer. So I think after this, we should all do exercise and eat appropriately. Okay, we have questions for Dr. Wan. Based on your future direction slide, may I know what type of micronutrient of interest that you may proceed in the future?
Oh, thank you for those that are asking this question. So it's quite interesting because we want to link relations to clinical pharmacology or medical pharmacology with in relation to nutrition, because these two areas is actually quite distinct with one another. So the micronutrient of interest that we want to share regarding this study project is actually we want to check for metabolites of vitamin D, because what we want to focus on, why we want to focus on vitamin D is that there are several studies, international studies that been shown that vitamin D metabolites have some effects once the patient already taking SGLT2 inhibitors. By means that if the patient are taking SGLT2 inhibitor, they also cause a deficiency in certain vitamin, especially vitamin D. So we want to take a look on that as well. Okay, thank you.
Thank you, Dr. Wan, for your answer. We have questions for Dr. Lim. Should we avoid fruits?
Okay. Yeah. Fruits is healthy actually in the aspect of mineral vitamins, but some of the fruits, actually all of the fruit has fructose, yes, but you need to choose those fruits that has lesser fructose and higher vitamins and higher fibers, such as like guava, which is high in vitamins, okay, kiwi, berries, all these, and actually my teachers told me that you should eat capsicum as your fruits as well.
Wow.
Okay. So we try to avoid fruits that has high fructose, such as mango, durian, watermelon, and honey lemon, honey melon also. Yeah, it's very high fructose contents. Some people, I think a lot of people will ask this question about banana. Okay, I can say banana is in the middle. When you eat like overripe banana, that is a high fructose contents. But if you eat just ripe banana, and you have more fibers, and you have rich of potassium and also vitamins, so just take in the moderate portion. Our food, actually there is no any food that you can say is exactly healthy or exactly unhealthy, because all the fruits and foods are having combination of vitamins, nutrients, sugar, everything. So I would like to emphasize that we need to take every type of food in every different color in a moderate portion. And of course, if you are having diabetes, so you must avoid those high fructose food, like what I just said. Okay, thank you.
Thank you, Dr. Lim. So you have to choose your fruits correctly and eat moderately. We have questions for Dr. Wan. Okay, based on the slide of exclusion criteria, what kind of drugs that may cause drug-drug interactions with SGLT2?
Okay, very nice question indeed. Thank you, Dr. Nasir, for this question. There are some in our exclusion criteria just now. We have mentioned that any drugs that can cause a drug-drug interaction should be the patient that having that should will not be entered in our study. So there are several medications that can cause drug-drug interaction with SGLT2 inhibitors. For your information, there are antituberculous drugs such as rifampicin. Aside from that, we also have anti-epileptic drugs such as phenobarbital and also phenytoin. Also, we have one medication that is used for retroviral disease such as ritonavir. So what I can see that this drug-drug interaction actually we must take into consideration in our inclusion and also exclusion criteria, because once we want to know the effectiveness of the certain medication, for example in this project SGLT2 inhibitor, we don't want any other medications to interrupt its action or lower its effectiveness towards our subject. Okay, I think that's
Okay, thank you, Dr. Wan, for your answer. We have one question from Nurul to Dr. Lim. What is the healthy replacement for sugars in our drinks?
Wow, that's a question.
Okay, actually, yeah, we can actually use monk fruit. Okay, that is good for our like replacement for sugar in our drink. But I would suggest drink more plain water. Okay, I just realized there's actually there's some of the people in their days they don't actually drink plain water. They only drink beverage. Okay, but you drink plain water. What is the healthy drink actually that I will suggest? I recommend to drink plain water and tea if you are okay and not allergic to tea, because tea has polyphenol. That is antioxidant. Okay, also some of good tea, good green tea has anti-cancer also. And also coffee. And coffee is actually good if you are not allergic to caffeine. But just because of we always add the sugar, excessive sugar or syrup in the coffee. So that's why a lot of people say coffee is not good. But actually, if you are drinking a black coffee or just coffee with full cream milk, is fine. It is very. That's all.
Okay, thank you, Dr. Lim, for your answer. I think we have one more question for Dr. Wan. What indications to give SGLT2 inhibitor in patients with coronary artery disease in this study? Can you explain?
Okay, interesting question as well. So, what indication to give SGLT2 inhibitor for this study? Okay. So, as we all know, I also want to inform to all of you regarding this. Actually, our Ministry of Health has already established a Malaysian clinical practice guideline of heart failure, which is launched in June 2023. So in this Malaysian CPG, it's actually already stated that SGLT2 inhibitor can be part of one of the medication lists to be for prevention in heart failure. So regardless of the diabetic status of the patient, so by means that if the patient having diabetes or not, patient can also be used their SGLT2 inhibitor to prevent for another episode of cardiovascular diseases, especially heart failure. So in relation to this project, actually the indication of the patient that the patient that been indicated to proceed with the project is actually we want to tackle both. By means that we want to tackle in anti-diabetic action, also inclusion criteria, and their HbA1c is poorly controlled despite they are compliant with the medication. So actually we can inform to the patients that patient can be advised for SGLT2 inhibitor, in which they can also protect in dual action. By means patient can have some protection for to lower their glucose levels, and also to improve, and also as prevention in further episodes of cardiovascular diseases.
Okay. Okay, thank you, Dr. Wan, for your answer. Moving on to the next questions. I think one interesting questions for Dr. Lim. How can we identify hidden sugars in our diet?
Okay. To identify hidden sugar in our diet, we need to check the nutrition facts labels on our packages on our food. Okay, so there are a lot of forms of sugars they will write in the label, such as like high fructose corn syrup, maltose, dextrose, or sucrose. Okay, all these syrup is all kinds of added sugar. Okay, and bear in mind there is some marketing term showing that natural or organic or healthy, all these products with these marketing terms, not necessary that it means that they have low sugar. So just need to bear in mind to check the labels, and to also take in account the carbohydrate content, which will break down into sugar in our bodies.
Yeah, thank you, Dr. Lim, for your answers. So after this, you have to check your labels properly. I think we have one more question for Dr. Wan. What role does epicardial adipose tissue play in cardiovascular health? And how might dietary factors such as sugar intake influence its development and functions? Questions from Nurul.
Oh, very, very good question, Nurul. I do think for this question, I think both of us can discuss it further, because as also regulates coronary vessel take. It can produce enormous amounts of inflammatory markers that by the end of the day can cause a further complication for those patients that having cardiovascular problems. And how might dietary factors such as sugar intake play influence in its development and function? I do think since that Dr. Lim already mentioned that there are types of sugars that can be metabolized directly without any influencing on other things. So by means sometimes sugar intake also can develop complications, as it will raise more thickness towards epicardial adipose tissue. How about you, Dr. Lim?
Yeah, actually, the excessive sugar intake will increase the store of fat, especially visceral fat. So epicardial adipose tissue is actually one type of visceral fat, which is actually surround our all internal organs, and especially heart. When your heart is surrounding by a very thick layer of adipose tissue, of course, the inflammatory marker that is produced by the visceral fat, which is an active fat, will directly go into the heart first, right? Because it's a location in the nearby the heart. Yeah.
So for information as well, epicardial adipose tissue has, based on several studies, that epicardial adipose tissue have shown to have more inflammatory markers that has been excreted in epicardial adipose tissue as compared to other visceral types of fat. Yeah.
Yes. Yes.
Okay. Thank you to both speakers. Okay, I'm afraid that is all the time we have for today's sessions. Any additional questions will be answered by the speakers through email. Ladies and gentlemen, we have come to the end of the webinar sessions. I would like to thank all the audience and participants for their support in making this session successful. Don't forget to subscribe to our National Institute of Health Malaysia YouTube channel. Before I conclude, I would like to announce the next IMR-SEAMEO webinar series, which will be on electron microscopy, contributions towards impactful research. We hope to see you again at the next sessions. Until then, thank you from all of us at IMR. Stay safe and take care.